Hello everyone, welcome back to part 6 of our muscles of the lower limb series. Today we are going to learn about the muscles of the posterior compartment of the thigh, commonly known as the hamstring muscles. The hamstring group mainly consists of four muscles: biceps femoris, semitendinosus, semimembranosus, hamstring part of the adductor magnus. These muscles play a important role in hip extension, knee flexion, and maintaining stability during walking, running, and other daily activities. Now, let's discuss each muscles one by one in detail. Biceps femoris. Its origin. Biceps femoris has two heads, long head and short head. Long head originates from the ischial tuberosity, short head originates from the linea aspera of the femur. Insertion: both the head inserts into head of the fibula. And action: at the hip joint, thigh extension, external rotation of the thigh; at the knee joint, flexion of the leg, external rotation of the leg when the knee is flexed. It also helps to stabilize the pelvis during movement. So innervation: long head innervated by tibial division of the sciatic nerve, short head innervated by common fibular division of the sciatic nerve. And blood supply mainly supplied by the inferior gluteal artery. So remember, the biceps femoris is the only hamstring muscle with two heads and different nerve supplies for each head. Semitendinosus muscle. Its originates from the ischial tuberosity, inserted on the proximal medial surface of the tibia as a part of the pes anserinus just below the medial condyle. Okay. Then action: at the hip joint, thigh extension, internal rotation of the thigh, and helps stabilize the pelvis. At the knee joint, flexion of the leg, internal rotation of the leg when the knee is flexed. Okay. So innervation is by tibial division of the sciatic nerve. So blood supply is mainly supplied by the inferior gluteal artery and also medial circumflex femoral artery. So the this muscle is a long cord-like muscle, okay, located in the medial side of the posterior thigh. Remember. Third muscle is semimembranosus muscle. It originates from the ischial tuberosity, inserts on the posterior part of the medial condyle of the tibia, and actions are: at the hip joint, thigh extension, internal rotation of the thigh; at the knee joint, flexion of the leg, internal rotation of the leg when the knee is flexed. And it also helps to stabilize the pelvis during the movements. So innervation is by tibial division of the sciatic nerve, and blood supply by the perforating branches of the femoral artery and branches of the popliteal artery. This semimembranosus muscle lies deep to the semitendinosus. Okay. Next is adductor magnus muscle. I have already explained that adductor magnus muscle in detail in my previous video on the muscles of the medial compartment of the thigh. So I won't be covering it again here. If you have not watched that video yet, I recommend checking it out for your better understanding of its origin, insertion, action, and all the functions. Okay. So one important point is to remember is only the hamstring part of the adductor magnus is considered a hamstring muscle. Okay. This part originates from the ischial tuberosity and is supplied by the tibial division of the sciatic nerve, which is why it is included in the hamstring group. Okay. Now let's move on to the most important part of my video, that is the note point. Today we are going to learn about the characteristic features of the hamstring muscles. You may wonder why certain muscles are called hamstring muscles. A muscle must have specific features to be classified as a hamstring muscle. Okay, so let's look at these characteristics one by one. First one is origin. A true hamstring muscle should originate from the ischial tuberosity itself. So as we discussed, the biceps femoris, semitendinosus, and membranosus, hamstring part of adductor magnus, what is that? All originates from the ischial tuberosity. Therefore, they are included in the hamstring group. Okay. And insertion point: the muscle should insert into one of the bones of the leg, either the tibia or the fibula. Okay. The muscles we discussed at that time, you can see there all muscles inserts into these one, either the tibia or the fibula bone. Okay. If you have any doubt, just check it. Then now supply: a true hamstring muscle is supplied by the tibial division of the sciatic nerve itself. It should supply by the tibial division of the sciatic nerve. Okay, then action. The muscle should extend the hip joint, flex the knee joint. Okay, these are the main functional characteristics of the hamstring muscles. So if muscle having all these features, it can be classified as a true hamstring muscle. Okay, next point is blood supply. The hamstring muscles are mainly supplied by the perforating branches of the deep femoral artery. So remember this point. And important note is, I already said that before, but again I'm saying only the hamstring part of the adductor magnus is considered as a hamstring muscle. Okay, the adductor part does not belong to the hamstring group. So if you remember these characteristic feature, you can easily identify and recall the hamstring muscle. So with this, we have completed the muscles of the posterior compartment of the thigh. Thank you for watching. If you have any questions regarding to this topic, please comment in the comment section. And if you found this video helpful, please like, share and subscribe to my channel. And thank you for watching. See you next time.